As usual, we are Ilium 360, and then we meet up to discuss interesting topics that are happening in the world of research and how it affects our daily lives. In the past weeks, we've been looking at diabetes, and then we have been looking at some of the symptoms and how to know that you might have diabetes. We have looked at some of the risk factors that will make someone prone to have diabetes. Um, Today, we are going to focus more on some of the treatments that are available for diabetes, and then prevention, and then how to manage diabetes. As usual, we have our two speakers, our experts, which is Rhoda Ananikakari and then Enoch Mensa. And they will take us through the presentation for today, and then we have our usual discussion after their initial presentations. So I'll leave it up to them.
All right, thank you very much, Enoch, for the introduction. Today we will do something a little bit different. We're not going to do the PowerPoint presentation as usual. We will just talk about the specific topics or subject we want to cover in a more discussion manner. I would talk more on the prevention measures and the management measures that can be put in place to either prevent one from getting diabetes, or if people are already in the pre-diabetic or diabetic situation, how they can manage it in order that it will not escalate, or at least to prolong their lives in spite of being diabetic or pre-diabetic. And here I will reference some uh, research outcomes for some tested met, strategies and methods. Um, Generally, one will say that if you know the cause of something, um, and then you avoid those things that cause the disease, then you are trying to prevent it, right? So back then we mentioned a number of uh, things that cause diabetes. One of them being poor diet, or even overeating, too much sugar intake and stuff, sedentary lifestyle, and all those things. In general, I can say that in order to prevent diabetes from affecting you, you must ensure that you are not within the causes. Even if you are within the risk factors that were listed, you don't compound it with the things that cause diabetes, like eating unhealthy food, overeating, lack of exercises, smoking, and so on and so forth. So if you prevent those measures, um, you are trying to, or if you avoid those measures, you are trying to prevent yourself from getting diabetes. And some of the factors I will talk about here, the research-based evidence that I'm going to talk about here, are same for both preventive measures and also for management. And the first one I will talk about is um, diabetes preventive program called DPP. And here, research found out that um, two combined intervention. The first, and they call it intensive lifestyle intervention. And with this intensive lifestyle intervention, they came out with at least two lifestyle modification. First one being low calorie diet. So you have to reduce your um, daily carbohydrate intakes, because the calories we talk about, most of them come from carbohydrate based food. It doesn't mean all of them. So first is to cut down to a certain level, and this probably the people would have to know uh, the required daily carbohydrate for them to consume, and then make sure that they don't exceed that. All right. And then you have to complement that with at least 150 minutes of intensive exercise per week. 7 weeks a day, right? Sorry, 7 days a week. So if we are talking about having an intensive exercise for 150 days, we're talking about at least or at most doing 30 minutes of exercise per day. It can be brisk walking, but it also should be a cardio related exercise. And this two combined increases insulin sensitivity. Remember, we have talked about insulin resistance, which is something that cause people to have diabetes. So doing these two together has proven to improve, or let's say reduce, the risk of getting diabetes by 58% in over, let's say, if you take 100 people and you study them undergoing these two activities, their chances of becoming diabetic is reduced by 58%. And this research was published in the New England Journal of Medicine in 2002. Another research finding was done on Mediterranean diet. And I think in our previous study, Rhoda mentioned something about Mediterranean diet, and here we're talking about certain specific aspect of Mediterranean diet, and that is food that was supplemented with extra virgin olive oil or nuts reduce the risk of developing type 2 diabetes by 30% in individuals with cardiovascular risk factors. So this is one other research that has found that uh, it tries to elevate um, the importance of uh, unsaturated uh, unsaturated fat in the fight against, or in the control or prevention of diabetes. And then high fiber diet. The findings showed that the high increase in fiber intake, that is between 25 to 30 grams. If you're able to take food that contains fiber and the fiber content is about 25 grams to 30 grams a day, this can significantly improve or promote resistance against diabetes by improving insulin sensitivity and then reducing the risk of being affected by type 2 diabetes. And this study was also published in Lancet in 2019. Um, I would briefly mention some management strategies, and then maybe if we have further questions or if we have more time, I can add some additional or extra information as and when necessary. So, like I said, when you come to management strategies, physical activity and blood sugar control, the research demonstrate that again the same 150 minutes of intensive to moderate exercise weekly, such as brisk walking, running, and stuff, will reduce the HbA1c by 0.6% in type 2 patients. What that means is that the increase in this factor HbA1c is related to or is associated with increased glucose level in the person's blood. So if there is some decline in such instance, then that suggests that it can moderate one's glucose factor and not allow the uh, diabetes to escalate. And then another management practice which we had probably talked about during our diagnostics or is the continuous glucose monitoring. You have to, if you are already pre-diabetic or if you are diabetic, you have to continuously monitor your glucose level. And if you are pre-diabetic and you are monitoring, it means that you are always conscious and aware of the levels, and so you put in measures to make sure that it doesn't go beyond the state where it will put you in diabetic or high diabetic stage. So that is very good. And again, low uh, carbohydrate diet, as I have mentioned earlier, is very important. And in our previous session, Jonathan asked about stress, right? Here it is stated that mindfulness and stress reduction is very significant for managing diabetes or prediabetes. And it says that mindfulness-based intervention, including yoga and meditation, improves glycemic control and reduce diabetic distress. So I think it's important to stay stress-free, even if you are not participating in yoga and meditation, but you have the state of mind where you are not stressed so much. It will help to manage your diabetes. Here, I will pause, and probably if Rhoda has something that she would like to add to the management, she can go ahead. Otherwise, maybe she can start talking on treatment, and we can come back again with some points afterwards. Or if you have some questions, we can take that.
Okay, thank you, Enoch. I think I don't have anything to say because it's very connected. So I think you touched on most of the treatment options, which can still be an option for prevention, as you earlier stated. So for the treatment, to make it a bit easy for understanding, we can group them into three.
Can we hold on to the treatment a little bit? I have a few questions on the prevention and
Ah, okay.
so that we will just not pile the questions up.
Okay.
Yeah. So you did mention of exercising like 150 minutes a week.
Hmm.
I have read in places that it's better to spread it out in more days than to do it like maybe just 2 days or one day, 150 minutes than to have 30 minutes. It's more beneficial to work each day and a moderate amount of time than to do intensive. Is that true or is it?
That is excellently true because if you do 150, so we're talking about minimum, okay? You can go beyond 150 hours per week. So if you do 1 hour every day for 7 days or for 6 days, you are way above. But if you are going to stick to the minimum, then it is important to spread it, because by exercising, what you're also trying to achieve is that you are trying to improve the uh, carbohydrate metabolism or glucose metabolism, right? And you are eating every day. Okay, you are consuming food every day. So if you decide that, okay, in one day I'm going to do 150 minutes, and then I have accomplished the weekly requirement, that effect is probably going to be on the metabolism of glucose and stuff at the time of the exercising. Okay, so what happens to the subsequent days, the consumption you make and the metabolism? That is why, of course, it is very important to spread it throughout than to have it done just at a go.
Okay, that's good. And then about reducing carbohydrates, is it? I mean, I've heard that there are two types of carbohydrates: simple and complex carbs. Is it the type of carbohydrates important, or all carbohydrates are supposed to be checked?
I can answer you for sure, but I maybe Rhoda will come in later if she wants. So basically, we mentioned that the end product of all carbohydrates, whether simple or complex, would be glucose. The end product of digestion of any carbohydrate you take is is going to be glucose. The carbohydrates from fruit and stuff, fructose and all those things. In the end, it's going to be glucose. What is different is that the complex carbohydrate go through stages of digestion before they get to the end stage, which is glucose, right? And so, for example, if I take direct glucose, it's going to work immediately in my blood. But if I take orange or stuff, the orange will need to be down into fructose, and the fructose need to be broken down into final stage of glucose, which can be used by the body. So in this case, I would say that any kind of carbohydrate that we take in should be uh, should be uh, if we
Reduced.
are talking about reducing, it should be reduced, yeah, irrespective of the source.
Okay, so just to also add up a bit, I think um, for the layman or someone who might not even know what carbohydrate is, we can say all the
Starchy,
food that are a bit starchy.
starchy.
Yeah, so you can avoid them at all, or you can also include them. And as we are talking about diet, we can also talk about certain fruits and vegetables which are also rich in sugar. You know,
Hmm. Hmm.
so the reason why we say less carbohydrate is that the end product of carbohydrate is usually increase in energy or sugar. And this is what we want to prevent when we have type 2 diabetes, because already your body have problems dealing with sugar absorption in the blood. So that's why he says we should decrease the carbohydrates. But for example, if we look at Ghana, most of our, let's look at a typical meal plan. You have maybe wache, and then the salad is usually less than the carbohydrate. So here the carbohydrate, which is the watch, the rice. So we have more rice. We sprinkle a little bit of salad, and then you have a small piece of protein, which is the meat, and then we have the sauce, which is also very overcooked. You know, and so I think that. When we say decrease the carbohydrate, then for a typical person who is diabetic, then you are looking at reducing the water level and rather increasing
Increasing
the
your salad.
salad and also your protein intake. So I think this is what we are talking. And look at when we look at kinky and fish. The problem is not the diet. So we can say it's a balanced diet, but the
But how much?
quantity, the how much. So you have a very big piece of kinky, you have a small piece of fish, and you have the sauce or the pepper to go with it. So if you are diabetic, then we say that you can increase or decrease this amount, and you might also want to avoid eating certain food as at certain times of the day where the stomach is unable to absorb and also digest certain kind of food. So I think just to add up to what Enoch said.
And maybe to finish on that one, an aspect of the dieting which is very important that we don't even take care of is um the sequence of the food. Um, I want to use a certain term, but maybe let me use the layman's uh, uh, term, that like you eat too much carbohydrates, and then or you eat even a certain amount of carbohydrate which is not too much, but you eat them all of a sudden at a go, and then the digestion of it increases or shoots up your glucose level or your sugar level, as we would all be common with. It increases your sugar level in the blood all of a sudden. On the other hand, research had proven that too, interlacing your food, your carbohydrate, with vegetables, like she said, and then also the meat, like she said, is very key at even regulating your sugar level. What it means is that, and this I even learned from one of my supervisors lab. She told me that also, even if I want to eat bread, what I can do with eating bread is that I should have a source of protein, so that it's not all about the bread digesting and increasing my sugar level, but the protein digestion would also um, help regulate the 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 sugar that is coming from the glucose. So even if you are going to eat, let's say it is recommended to eat a handful of rice as a diabetic patient or something, you may not want to eat all the rice at a go or at a sitting. You can divide it into portions and then interlace that with um, other source of protein or something. And this, what you are doing is that you are trying to regulate the blood sugar level so that there will not be a sudden surge, because when there is a sudden surge, then it sends signals are sent to your pancreas to produce insulin, and this the stress on this communication in the body hormones and stuff is what also accounts for um um sometimes the resistance and also the insensitivity of the insulin to glucose in the body. So as she said, how much you eat, the sequence you eat it, the time you eat it. When it comes to diet, we can talk a whole lot about dieting alone. That will be necessary to help. And I remember even before getting into uh, these studies or this topic becoming interest, maybe 10 or so years ago, I lived with one old man who I didn't even know was diabetic, but doctors told him to eat his food in bits and in pieces. And then when I get exposed to this topic, I realized why that had been recommended for him. And he was living strictly with it. He died after over 95 years and he had diabetes, right? So I think some of these practices can be very difficult to start, but once we put them in place, it can help at least prolong our life despite the threat of diabetes.
Okay, also just to add a bit on the diet, and I know we want to do another series on this, but because we are talking about prevention, and so for the dieting, just a tip for the people, we can have, as Enoch said, intermittent eating. And now it's very common, we have intermittent fasting. And as the name implies, so you can eat everything you want to eat, but well balanced diet. So I eat today, I eat tomorrow, and then I fast the next day. It's like the Ramadan, It's also a form of fasting, and a lot of studies have shown how it improves health and all that. So it's similar. So you can eat all your food for 2 days, and then you fast. Then after 48 hours, you fast for maybe 24 hours. That is the whole day, and only taking water, and the next time you fast again, so you are fasting maybe twice in a week, and this they call the intermittent fasting, and it has proven to be very effective. And of course, when you are into all this kind of fasting, and then you can eat anytime, we are talking about balanced diet, so you avoid white rice, white bread, so you stick to whole grain food, fruits
Yeah.
and vegetables which are rich in fibers. They also
Mm,
are able to boost your nutritional need, and you avoid eating late in the night where your stomach cannot function, because then your brain signals the stomach that, oh, we are taking a break for the day. So that is also one of the reasons why we don't eat very late in the evening. You can eat, but it should be something which is very easily digestible, maybe a fruit or something. And some people also have the time restricted feeding, as Enoch already mentioned. So this is usually done for people who are also pre-diabetic, or they are in the onset of diabetes. So they can advise you to have a time restricted feeding. So here you have maybe your breakfast from 8 a.m., and then you eat a well balanced diet at that point, and in the afternoon you eat your main meal, and maybe from 4 p.m., so every day you have about maybe 16 hours of fasting from the evening to the day. So that is, then you actually practice what the English word breakfast is. So you actually break your fast in the mornings, and then you eat most of your food during the day. And of course, together with this time restricting feeding, you can also add caloric restriction. So what happens is that you are restricting how much calories or how much sugar you are eating at a time. So what happens is that, and then so that is one popular thing that a lot of people who are into health and exercise now are doing. So under this caloric restriction, we can have portion controls, as Enoch already mentioned. So instead of eating maybe 1,000 gram, or you aim to eat 1,000 gram of carbohydrates per meal, or sorry, 1,000
I think
kilocalories kilocalories of carbohydrates per meal. So what will happen is that if maybe you are eating for the whole day you aim for maybe 3,000 kilocalories, for example. This is just example. So you eat smaller portions, and then when you're hungry, you feed your hunger, you eat another smaller portion, because a lot of studies in humans and also in animals have shown that if you fast a lot and you starve your cells, you become more hungry and then you crave for more food. So that is one way to restrict this. But I will say that they can also contact us as Alien 360, because we also have a lot of ideas, and we can also plan meals for people, and then we can also plan diet, because and if you go to the hospital now, even in Ghana, we have the diabetes clinic, and I've forgotten uh, which day of the week they have this clinic, and they have dietitians. So this you can do alone, but you also need the help of a dietitian, because each person, your body tone and the status of your diabetes and your health, your family history demands different things, and how complicated your disease is. So it varies from patient to patient. So I will advise that you see a nutritionist or a dietitian, the person help you with a meal plan, and then you can go through together, and also you get someone to boost you as you go through this journey, and then you're not alone. Yeah.
Okay,
So should I
that's very
continue
good.
with the
Yes.
treatment?
Oh yeah. Yeah. Take us to the
Okay.
treatment.
So for the treatment, we said a lot. So I divided into two parts. The first part we've already dealt with, that is the lifestyle modification. So for the lifestyle modification there, I was looking at balanced diet and exercise, and that Enoch has touched on it. So for the sake of time, I also um, will not touch on this. So then we continue. And for the next one, sorry. For the next one on the treatment, we can have, um, sorry, let me check my notes. We can also have medications. And so for the medications, we have two types. We have the oral ones and we have the injectable ones. And depending, so who takes the oral and who takes the injection. So for medication, what I would like to say is that if diet, exercise, lifestyle modification alone is not sufficient to treat your type 2 diabetes, then we have to target the glucose level. And so in this case, then they are giving oral medication. And the first line of treatment now is the biguanide, which example is the metformin. It's very popular, and when you are pre-diabetic till the diabetes state, you can be given metformin, because it's the first line of treatment, and it has shown a lot of increased efficacy in alleviating these diseases. So especially for people who are pre-diabetic, but it's good to consult a doctor, because different people take different doses depending on your body weight, depending on your history. Do you have high blood pressure? Do you have heart diseases? So this determines the kind of drug combination you get for your treatment. So together with metformin, people are also given other type of medication. We have a lot of them. We have the sulfonylureas and all these ones. People, you can take it alone or in combination, but it's not something we can advise you on this chat, because it's your doctor who will prescribe this based on your need for you. And if all this fail you, another option is that you can also go through insulin therapy, where you are given insulin. That is if your lifestyle modification, oral medicine, and everything is not enough to help you, then they recommend insulin treatment for you. So you are given the insulin treatment, and then you can continue your the oral medication alongside. And if you are really obese and then you have fat stored in your belly, that is to say in your belly, then you can go through bariatric surgery. And there's a lot of US popular actors and actresses who have undergone this procedure, and it has shown a lot of improvement in disease. And so they take all the fat from your stomach, and then because as we mentioned in some previous videos, the anatomy of the fat distribution in our body affect how the disease progress. So if you have more fat stored in your viscera, that is in your abdomen, then it means that you are prone to higher risk of getting the diabetes and its complications. So you can treat by taking the fat away, but it's not a one time and it ends. You can have diabetic remission, so it can come back if you don't stick to proper lifestyle modification and also the exercise that we said and all those things. And the last part we'll say is glucose monitoring. So as Enoch already mentioned, you check your HbA1c consistently, maybe 2 to 3 months they can monitor, and you can also do the finger sticks where we showed in the diagnostics. You prick, you check every time, and so these are all ways we can use to treat diabetes. And we want to say that the treatment and the prevention is very important, because if you miss this part, then you can prevent going overboard to the complications that comes with getting the disease. But if you are already there, if you already have the complication, for example, if you have high blood pressure as a result of your diabetic state, then in combination of all this treatment, your physician will also treat you with medication to manage your high blood pressure. And it also depends on, so that also determines what kind of medicine you will get in this regard. So I want to end here and ask if we have any questions, and then we can discuss more. Okay.
Okay, thank you, Buddha. So basically, what I got from your presentation is that when it comes to treatment, you shouldn't try to do it yourself. You should seek medical help. Yeah. So, so one thing I want to ask is, what about, in our setting, in Ghana and Africa, these traditional treatment methods? What are your views on that?
Okay, for me, I'm always for modern disease. Not because one reason is that
Modern.
modern medication and modern treatment. So I'm more of yeah, I'm not of the traditional method. That's the herbal medicine, because especially in Africa, most of them have not well stipulated known side effects, and most of the disease, these herbal medicines are being over exaggerated. For example, paracetamol cures headache pain, we all know that. But when you go to the herbal medicine, the same drug which is curing your diabetes is curing your hypertension, which is okay, it can happen. But then the same thing is, if you want to improve eyesight, if your swollen legs, it's more of marketing. And I think we also don't have a lot of research and also a lot of insight into this herbal medicine. For example, if you come to Europe, when I go to the hospital, I have never been given any drug which is not herbal before. I'm always prescribed a herbal drug, but it is certified, it's not over the counter, it is well made, the side effects, and if the side effects are not known, there is open discussion that is written in the leaflet. We don't know of any side effect, but look out for it. So if we cannot tell all these things, then I'm sorry, for me, I'm not for this herbal medicine which can cure malaria and at the same time cure diabetes. So before you stick to this herbal, visit a herbal hospital which is accredited, and it has a lot of doctors who are learned. Don't just buy over the counter or buy from outside. And also, if you go to the hospital, you might get to know all the diabetes complications that you might have, because something that I really missed in this presentation is that if you are diabetic, as part of the treatment, you need to go for an annual review where we check your eye, your lungs, your liver, every organ which we discussed during the diabetes complication, during and when Enoch
Right.
gave the lectures. You need to review. We have to check your leg, to check your nerves, to see if so that you don't get your foot amputated at the end or you don't go blind. This I'm not sure the herbal doctor can do, but if they can do, go for it.
Okay, so quickly, I would add to Rhoda's points well made. Um, the issue of side effects of the herbal medicine or the traditional treatment, it might not even be those which are sold in the shop, but those which are locally made by the persons themselves. They put some herbs in consider and they do it. Um, Sometimes we think we cannot overdose or underdose this traditional herbs, but it's a lie. And most of the orthodox medicine, they have the same compounds or um, stuff that they use from that the herbal medicines have. But what is different is that they have gone through clinical trials, right? And clinical trialing, I mean, they have tested it on people at different stages. There are several stages. It has to pass animal test before they start clinical trials. There are about three stages of clinical trials and stuff. And this it's going to see how different people will react to the drug, the side effects, the efficacy rate, and all that thing. All those things are factored in before the drugs are let out. Unlike what we do by ourselves or we go to the local market and buy the traditional medicine, which have not gone through any of these stages but have been certified. And so, and whether they taking it underdose or overdose, it has implications. For example, I was conducting a research and I talked about in the past when we were kids, we even knew before that uh, pawpaw, papaya, the seeds is noted to be a great dewormer. And then I was talking with my supervisor, and in our research we have something we call papain. We do research on um, worms that affect humans, and we're talking about. So he told me straightforward, pawpaw seed contains a lot of papains, and these papains they are inhibitors of certain molecules in the worms, and when they inhibit those molecules, the the worm is not able to function effectively, and it kills them or something. So the person who is studying papain in this protein or this inhibitor in the lab, it's going to go through several processes, measure the exact quantity that is needed by the body, and it will not become toxic and stuff. So that is why I will agree with Rhoda when she says that she is in favor of orthodox medicine. These days, I have also seen biomedical researchers or One Health Research trying to work in close proximity or association with traditional healers, right, to find a balance between the traditional healing strategies and then the orthodox healing strategy. For example, in some local settings, snake bite, traditional healers are very expert and good at curing snake bite and stuff. And of course, the orthodox researchers are also working in collaboration with them to see how to improve the situation and stuff. So I feel that sometimes, like she said, if you go to the hospital, they will test certain aspect of you and they will know that actually the combination of this drug will be better for this person. But if you sit down, you might be targeting just one aspect, and if you had complications, that other aspect of the complication, the disease is not going to, the medication that you are preparing locally is not going to tackle that. And in the end, the efficiency of your treatment is at stake. So first, it's always very important to consult a medical doctor, get the review, get all the stars done. Like she said, they don't do that's what I said, the physical examination. These people they will not do that for you the long as they need that it says you have diabetes. And if you have the diabetes already, like she said, the complications are already in place. So when they are just focused on treating diabetes, if you have already suffered heart, issues, it's going to be there, so it's very important. What I would ask Rhoda is that there are times that people are saying, especially some men, when they're giving BP blood treatments and this diabetes treatment, they don't take them because there is this issue going around that when you take them, it affects your manhood and performance and stuff. Have you found any research or something about this saying, whether it's true, whether it's factual, or whether it's speculations?
Actually, I have seen a research paper which talks about dysfunction in some of these diabetes um, drugs. But what happens is that it's not a long term. So it's the dosing. It's the dosing. So that is why it's also in line with the question pre-diabetes. We had a whole lot of session we talked about pre-diabetes. So if you're pre-diabetic, you take your medicine or whichever recommendation from your doctor, you can revert, you can go back to normal glucose level. Or even if you don't go, it can take a long time for you to reach that glucose level so you can manage the disease. And if you are diabetic and you are also at the peak, erectile dysfunction over heart failure over amputation, which one will you choose? So then the doctor will go for the one which is beneficial for you at that time. So when you go through your treatment and you stick to the treatment plan effectively, within a month or two, when your glucose level comes down, your oral drug or whatever treatment you are on will decrease, because if not, you can also go into hypoglycemic shock. So then it's not something that is permanent. That is why we talk about lifestyle modification and all that. Some people have diabetes, they don't monitor their glucose, they take everything for granted. So the more you are thinking about this erectile, whatever, if you have taken your medicine, what I also realize is that it happens in older men. According to the paper, it was in older people because usually people who are type 2 diabetic is from age 45, as Enoch mentioned some other time, it's in older people. So at that time, your disease is at its peak. But if you manage it well, then all these things is reversed. But sometimes even not taking uh, the medicine and proper treatment can even lead you to this erectile thing you are talking about, because then you can also have kidney problems, liver damage. I mean, even one of the main diabetes complication is thyroid cancers, stomach cancers. It's more complicated than we view it. So then what is, let's say it's true, so what is erectile dysfunction over all these things which can be managed.
I mean,
And
I think because you're not a man, you are downplaying it, but it's very important to us men.
I mean, it's very important. So that is why today and for the past 3 weeks, we've taken the time as a group to educate you on this disease. So prevention, prevention, prevention. So that when you are in your 60s, when all your kids are not home and you want to be in honeymoon mood, you don't end up this way. But for someone out there who also already is suffering, I would say you should not listen to the society and what they think about these things, because at the end, this is not a permanent something. And if you stick to your exercise, you manage, at a point you might not even have to depend on all
The
these
drug.
oral drugs which will lead you to that part. And in case you're already complicated and you have to depend on it, who
Right.
cares? Yeah.
Okay. So in the end, what we are saying here is also that um, even this erectile dysfunction that people complain of, and the reason why some of them don't take their medication is that it's not permanent. It's not a permanent
No.
situation. If you take and then your levels come down, you can you can have your something, and
Yeah.
and be
And
and
it's
be
also
functional.
it's also part of the complications we're talking
Patience.
about. Yeah.
Okay. Okay. Thank you very much.
I know this is not a dieting thing, but since we're doing diabetes and it has a little bit relation, I also read at places that this keto diet helps because it's basically based on reducing carbs in favor of fat and protein.
Exactly.
Yeah, so is the keto diet in
Yes.
general good for managing or dealing with diabetes? And then is there any maybe some other complications from that diet as well?
Okay, so I made a little research on keto diet, but maybe if Rhoda wants to start, if she can start, and then I can join in. If not, then I will find my research I did and then talk about it. But I think that you have sum it up. The keto diet is characterized by high fat, but here we're talking about unsaturated fat, or let's say good fat, okay, and then moderate protein and very low carbohydrate intake. And maybe some of the things that we didn't mention about the dieting and everything, it's also to manage weight. You remember in our previous sessions we talked about um, overweight and obesity as risk factors to getting diabetes. So the dieting we spoke about, apart from trying to improve insulin sensitivity and then regulate your glucose or sugar level, it also aim at reducing weight, and that is also one end result of keto diet. Research indicates that keto diet can significantly improve glycemic control and facilitate weight loss in individuals with type 2 diabetes. So that is one aspect of it. And regarding um, some negative effect, if you are doing this, there is the high tendency that you might be missing out on adequate nutrients, some vitamins, some minerals, and stuff. And so it is depending on what kind of food you are eating or combinations of food you are eating. You should also probably monitor your certain vitamins level. And I mentioned that, for example, vitamin D is typical. Um, Lack of vitamin D is a typical cause of diabetes. I may not say that one only, but it acts in relation to other risk factors to let the disease occur in the person. So when you are doing the keto diet, the fasting, the intermittent fasting, and all those measures we have put in place, you may stand the risk of losing some nutrients, which can also complicate other stuff, maybe not diabetes specific, but result in other medical complications or situation. So it is important to check out this and then um, um, make sure that you are getting sufficient nutrients that are necessary for proper functioning of a person or of the body. So basically, that is what I would want to say about keto diet. And there is an information here. It says that there was a review noted that individuals on keto diet often experience a decrease in need of glucose lowering medications. So the metformin that Rhoda mentioned, which is also for lowering your blood glucose or blood sugar, people who are on keto diet are less likely to undergo such first line of treatment because the keto diet itself is helping to reduce their glucose intake and their glucose level in the blood. So then there is no need to go for this medication. And then on the weight loss, it has been associated with significant weight loss, which is beneficial for individuals with um, type 2 diabetes, as excess weight is a major risk factor of the condition. One thing I want to highlight here are what we call, so for example, we are saying people need to take healthy fat, right? Healthy fat, proper or good fat over improper fat. I will just focus on what we feel or what are unsaturated fat or healthy fat that people will need. and the sources where they can get these things from. I think this will be practical in moving forward. So, for example, when we talk about unsaturated fats or healthy fat, we have the mono unsaturated and then polyunsaturated. The mono unsaturated, I don't know how to explain it further, but some of the sources are where you can get them from: olive oil, avocado, and several nuts. You have the almond, you have the cashew, you have the hazelnut, macadamia nuts. So many nuts are rich in this kind of fat. So of fat. So instead of eating saturated animal fat, it is recommended that you eat some of this. We also have the seed, the sesame seed, the pumpkin seed, the sunflower seed, the canola oil, the chia seed. These days they have the chia seeds, which are also sources of omega-3, and this is the polyunsaturated fat. So the fish, the fatty fish, like the salmon, the oli, I'm sorry, yeah, let's say salmon, the mackerel, the sardines, these kind of fatty fishes, they have the omega-3 oil, which also contain vitamin D, very important. And then the flax seeds and the flaxseed oil, the chia seed, the walnut, the algae oil. And then also when you come to the omega-6, we have the soybean oil, corn oil, sunflower oil, and then safflower oil. So these are some of the sources of healthy fat that are recommended to be consumed rather than the fatty animal fat, or the fats from animals which are saturated and unhealthy for us. So if somebody is wondering where to get this kind of healthy fats, we have mentioned some of them here.
So yeah, thank you everyone, and thank you Rhoda and Enoch for the wonderful discussion on diabetes. It's been a very good discussion for the past 3 weeks, talking about diabetes and all the information you gave us, which some of us might not have known at the time. And so this will be the end of our discussion on diabetes, but there will be subsequent topics coming up. And not just in health, we have finance topics, we have IT topics, we have some in climate change, and a whole lot of topics that will be coming your way. So just watch out for us, and we'll be updating you on which topics we'll be coming up with subsequently. Thank you all for joining us, and hope to see you soon next time.